Well, welcome and good morning, everyone, or afternoon, depending on where you're at. Just give it another second or two. I know a lot of you are still coming in, so I want to make sure everyone's in and ready to go here. I wanted to say, today we do have the pleasure of bringing some opportunities and some education to our members. We have a lot of information on wellness and longevity products that our pharmacies are utilizing and already asking to help support that GLP-1 craze. So thank you all for being here. My name's Shannon Battle. I'm the Pharmacy Services Manager here at Independent Pharmacy Cooperative, and I'm joined by my colleague, Samantha Pomeroy. She's the Director of Pharmacy Services and Specialty Programs. And then we also have our friends Hayden and Erica for Olympia Pharmaceuticals. So glad to have you all here.
Thank you there, Shannon.
Awesome. Well, IPC has been working with Olympia for a few months now, and we've secured great pricing for both our GPO and warehouse members at IPC. But above that, the opportunities for pharmacies are endless here. And we really want to make sure that all of our viewers understand this space and how to make it work. And that's why we have you here. So I do appreciate you again all for being here. Sam, you are really the voice of IPC for our stores. They reach out, they do consultations with you and are talking to you about this space. What kind of things are you hearing right now, in the GLP-1 space?
Well, not just specifically the GLP-1 space, but when it comes to, having this type of offering, anytime I talk to a member, no matter really what we're consulting on, they ask, Sam, where are my cash opportunities? I need to bring in some more cash business. I really would love to get started with something like this and not have a large upfront, investment or cost to make sure that it's going to work for my patient population and in my business. So I think that is what's so wonderful, about working with Olympia and these 503B products and potentially bringing this into your pharmacy and having this offer for your patients is, it's cash business and it's something that your patients are looking for. This space has grown significantly. We've all seen that. We talk about it, continually. And I think that we've really found a great relationship here with Hayden and Olympia Pharmaceuticals for our members to be able to feel at ease with this. Kelly, our pharmacist in Pharmacy Services Department, she did an on-site visit with Olympia, and she was super impressed. They have an amazing facility. And we've been very impressed with the clinical team and with the customer service that we've received. So I think that a message that we are giving to our members is what else is there besides, GLP-1s? That's just been such a boom, right? And it's affected so many patients. But beyond that, what else is there that we can offer our patients in our pharmacies? So this is cash to me. It just makes perfect sense for our members, and we're excited to hear more today, Hayden, and get some education so that our members feel confident in this space.
Yeah, absolutely. And it's so funny we first bring up GLP-1s, right? I think GLP-1s really came about simultaneously and alongside 503 beta A outsourcing that allows pharmacies like us, Olympia, to outsource and dispense product without patient labels, just product that'll sit on your shelves to then dispense to patients. So those coming together kind of at the same time really allowed for not only relationships with independent pharmacies to blossom, but it really exploded the world of telemedicine too, making it just more readily available for telemedicine practices across, I would say the entire industry. And now we're at a real kind of fork in the road, right? GLP-1s are a thing of the past. 503Bs aren't able to produce them. They aren't found on the shortage list. They aren't found on the bulks list. So where do we go next? And I think there is a ton of opportunities on the horizon, and I really think a strong push here, second half of the year, Q1 of 2026. We're going to see a really big push in longevity and wellness, and we're ready for it.
Great.
That's perfect. I know we have a lot of members that are on the webinar today that are not, they don't know anything about this space. The GLP-1s were easy to jump on and provide that to the community, but they don't know what to do now or what you guys offer. So would love to hear, all about that and what you can really give them.
Yeah, absolutely. I mean, we still have, and little to everyone's knowledge, there is still a GLP-1 out there found on the national drug shortage list. And kicking it off with liraglutide, it is a pretty good alternative. I would say it's going to be better than any mixture of lipotropics, B vitamins, anything other than semaglutide and tirzepatide. This is going to be our next best option. Patients, I believe, are seeing anywhere between 8 and 11% weight loss, I believe is what studies have shown with the commercially available product that is in shortage. The one downfall is that it is a daily injection. Now, toward the end of GLP-1s, I would say, being on the shortage list, more and more, I would say clinicians were I guess leaning or headed toward a route of microdosing semaglutide and tirzepatide, right? The more frequent injections, just smaller doses, which is great and all, but it also definitely fits the mold of liraglutide. Liraglutide's a daily injection, right? I think it's perfect for a patient that maybe hasn't been on a GLP-1 regimen looking to get started. This is definitely an opportunity to get going, which is going to be cheaper than potentially the commercially available options out there with Wegovy and Mounjaro, potentially, right? Or Zepbound. So definitely a great option. Patients are going to see the results that I think they are looking for, especially if they are just getting started, because not all pharmacies have access to Zepbound or Mounjaro or Zepbound, Mounjaro, and Wegovy. Jeez Louise. So this no doubt is a phenomenal option. So this is a little tidbit or little, I guess, resource that our clinical pharmacy team put together. And this is just an example of, various resources you'd have at your disposal when partnering with Olympia. I'm sure folks over at IPC have some great resources as well, but we have a team of 6 clinical pharmacists that are sitting by the phones ready to answer questions, concerns of any of our clients. But this is one slide that they put together, which just shows the actual dose and how much you would need to pull up at each dose of that liraglutide regimen alongside the conversion chart for dosing. One thing we did with liraglutide before rolling it out, we were really thoughtful in the concentration. We wanted it to really mirror one another. Something we didn't do in our previous vials or formulas with GLP-1. So you're looking at a 6 mg per ml, 5 ml, 10 ml fill. Makes it really easy for patient education as well. That was the biggest thing for us when rolling out Lyra.
And the dosing guides and product information you guys have on your website is just phenomenal. You have something for everything, and it's going to be a huge resource for the stores.
Yeah, absolutely. And I mean, even the things that we might not have on our website, right? Our clinical pharmacy team, they have an email that you can reach out to them at. I think it's askthepharmacist@olympiapharmacy.com. They have a phone number, and they are very responsive and willing to jump in, help anytime they can. So this was so kind of branching off GLP-1s, right? I'm probably not going to bring them up the rest of this webinar presentation. So
I want to know what's new and next, right? What's
I know,
what's the
right?
next
So
thing?
that is a GLP-1, right, Lyra? But I think this is where the big push, where a lot of larger, I would say, telemedicine practices are headed towards. And with that, the larger telemedicine practices are going to really influence the entire industry when it comes to health, wellness, longevity, just because they are marketing giants in all reality. So here are some alternatives that we came up with as we saw semaglutide and tirzepatide being sunset. These are products that were definitely very popular prior to introducing sema and tirzepatide. So the MIC formulation in the burn bundle is phenomenal. We are seeing a huge uptick from, an outsourcing perspective. I mean, I was speaking with one pharmacy earlier this week. They're ordering upwards of 1,000 vials a month, right? So there is a need out there, and people are looking for a safer, the long play in terms of options out there. These products aren't going anywhere. They're found on the bulks list. So they are here to stay. So we introduced the Burn Bundle and Skinny Set as just an alternative for anybody that's looking to maintain, any weight loss that they have experienced while on GLP-1s, or anybody that is just looking to lose a few more pounds, right, with the Burn Bundle. I think the MIC is a great option, L-carnitine. It serves as some sort of appetite suppressant as well. So these are phenomenal options. Nicole Snow, as you can see there, she is our head clinical pharmacist on that team and really is pivotal in putting together some of our newest products bundles that we roll out.
Hayden, you've mentioned telemedicine a few times, and I
Yeah.
think that that's great. IPC, we've created a digital health platform in iCare Plus for our GPO members, and that has integrated telemedicine, into those virtual healthcare centers. But for our warehouse members that are on as well, this offer is open to our GPO members and our warehouse members, or anyone that maybe is not specifically, working in the telemedicine space or have that incorporated into their pharmacy. What's one tip that you could give them in going out into their community? What clinics are they looking for to kind of start marketing this and seeing what need is out there in their community?
Certainly, certainly. And I appreciate you bringing up yes, I have mentioned telemedicine a lot. I think with that, not I understand independent pharmacies, not all of us have those connections or are working in that space, but in all reality, the large players that are out there in telemedicine, like I'd mentioned, they're marketing giants. They're going to be putting products like you're seeing right here in front of us in front of patients daily, whether that's on the TV, whether that's social media. But in all reality, to be able to go to your, community pharmacy and be
Mhm.
able to, purchase these products from people you trust, people you've been, going with or getting your scripts from, since the beginning of time, they're trusted, right? I would much rather go to my local pharmacy and get exactly what maybe a Hims and Hers is offering, right? Um, so I do think that is very important in terms of the practices that we might need to really hone in on. I think any general family practice is good. Urgent care facilities are also great. They're usually looking for some form or fashion, some sort of a product that'll help with hydration or overall wellness. Um, I think any functional medicine practices, holy mackerel, this is right up their alley, right? And I think we might have a webinar later this month that might be speaking more toward urology practices as well. So, I mean, I think as long as you have I guess, tools in your tool belt, whether that's marketing material that we can provide, more clarification on products from our clinical pharmacy team, it's really going to aid in, some of that outreach that is done within your community as well.
Okay, great. Before we go on to the next slide, Shannon, I did want to mention, I don't think we mentioned this in the beginning. If you have questions throughout, please put them in the Q&A section. We also have Erica Hahn from Olympia team, and she's happy to answer, any questions that you put in there. Please ask, while we're on the webinar. I think that would be great, addition to our conversation. So.
Absolutely. So these products here, so this is actually just a snippet from our product catalog. These are products I would say that any functional medicine practice looking for an alternative that is not associated with a GLP-1 is going to want to at least look at, right? Or consider. I mean, the lipotropics you see here, Lipomino C, Lipo Plus, MIC, no ifs, ands, or buts are phenomenal products. And really were the main products we were selling for weight loss specifically ahead of, those, I won't mention them again, those products ending up on the shortage list. So Moreland, I cannot preach some Moreland enough at this juncture. This product in particular is going to really blossom, I think, just based on the conversations I've been having with some of the largest out there. I think it is going to be a big hot product. Now, when talking about those products that ended up on the shortage list, we see a lot of loss of muscle mass. I think this is a perfect plug-in for Simorelin. It'll help those patients retain that muscle mass. If they've lost a ton of weight, well, how are we going to gain that muscle mass back? I think Simorelin is huge in that particular use case.
Now, is
Have you
Samorlin available yet, Hayden?
Yeah, so Simorelin is available, and there's some exciting news that we have with Simorelin. So right now we're offering a lyophilized product. What that means, it's just freeze dried. It has a very robust beyond use date. It's 360 days from the date compounded. It does have to be reconstituted though. So we'll, either supplied by the pharmacy or you could, I think, purchase it from us as well. Um,
Mhm.
it'll be reconstituted prior to administration. So there's a little bit more education needed with the patient on how to reconstitute, how much volume to reconstitute with, so on and so forth. So I believe around November, we are going to be launching a liquid formula, and November being the latest. We're really pushing quality for an October launch, but quality likes to take their time, and we love them for that. But we are excited about a liquid formula. It's going to take a lot of the educational piece out of it when it comes to Simorelin. We just recently did it with our NAD, which you'll see. I'll speak to it later in the deck, but we're really excited about it. I think eventually we'll end up coming out with some sort of a 2 vial bundle, NAD and Simorelin. And I know peptides, that's a big, I mean, that is a hot word right now. Anytime
Mhm.
peptides,
Yes.
people are
yeah.
jumping, right? Um, don't know if people know, Simorelin and NAD are both peptides, and they are found on the FDA's bulks list, which gives us free reign to actually produce those. But yeah, I think you'll start to hear Simorelin come up quite a bit more here in the future. So amino acids. So you might have seen our amino blend in one of those kits that we spoke about previously. The amino acids are phenomenal, helping increase blood flow, specifically with arginine. We actually see arginine being utilized as a precursor for many cases that we will talk about ED, funny enough, but they are great to pair with any sort of lipotropic that you might be doing, or amino acids and B vitamins are very popular as well. So I would also really consider some of these. I think functional medicine practices are going to love them. I think the one standout product that I see is smack in the middle, glutathione. With I'm going to say it now. It's going to fly later half of the year. It's one product that um, we're currently working with when it comes to the largest in our business in terms of wellness. They have highlighted this product as one that they are going to really push on their end. So once they push it's a big copycat industry. Once they go,
Mhm.
everybody else will, and that will ultimately impact what's being put in front of patients, and glutathione is most definitely one of those. Powerful antioxidant. I love it. It's also found in our Triimmune Boost, which I love and adore. It's a phenomenal product, no doubt about it.
Yeah, definitely starting to see the marketing ramp up there. Like you said, it's a copycat industry. So get in,
Mhm.
early on these type of things and get the education behind it.
Oh yeah, no doubt. I mean, we always call it first movers advantage. If you're willing to, or if you have what you need to actually start pushing this now and have people educated ahead of when, we really start seeing it out in the forefront, I think you're just setting yourself up for success. No doubt.
Mhm.
Longevity. I will say marketing did a fantastic job on this slide. I think it's quite beautiful.
It's actually one of
Right.
my
Yeah, they were going for more of a, I think, what was it? I don't now I can't remember what the hell they were, but yeah, great job marketing. Shout out. NAD. So this product in particular, I just mentioned it when we were talking about peptides. It is a peptide really honing in on longevity. Previously, we were offering a 500 milligram vial. It was lyophilized, needing to be reconstituted. So pharmacies, telemedicine alike, they weren't very fond of it. But, IV, I would say anybody that was doing IV infusions, they loved it. And they just, I will say, have fallen in love with our newest formula as well, because they are now getting double the amount of product at 1 gram. Um, and with that, it is half the cost. So we were able to drop the price point. Our base price, and look, IPC is getting phenomenal pricing, but all I know is our base price was like 132. We were able to drop it to 64.80. That's base. I think IPC members are getting it somewhere around the ballpark of like 48 and some change, if I'm not mistaken.
Pretty sure it was
So
48, 48,
I
60,
mean,
something like
yeah,
that.
this is a heck of a deal, something that we really wanted, your members to have access to and have access to it rather, affordably, right? And again, I think to Sam's point, it is great because it's a cash-based business, but it's also great because we don't necessarily require any minimum orders, right? I mean, you could order or maximum orders. You could go on, purchase 1 vial of this for $48.60, I think you just said, Shannon. And I mean, just trial it, right? I mean, I think it's definitely worthwhile. But with this transitioning to a liquid, it's really allowed us to increase our capacity with production. Previously, we were only producing, I want to say, somewhere around the lines of 2 to 3,000 vials weekly. We're able to now produce upwards of 12 to 15,000 vials weekly. So it's really allowed us to grow that side of the business as well. And people just love the fact that they're getting double the amount of product, half the cost, and full transparency. It's always been a big product for us, but it is no doubt a front runner.
I will say, that's one of the things that, was a must for us, Hayden. We have pharmacies that are wanting to test the waters, and some of the other, 503Bs that we looked at, they had a max order. Sometimes you had to order 25 vials of something, and for some of our pharmacies, that's okay. And for some of them, it's just not, they don't really want to spend that much up front and not know if they're going to move it. So the fact that they can just order 1 vial of something, trial it with the patient, is a really great thing here.
No doubt. And we see it, all the time that not all practices are created equal, not all pharmacies are created equal, but we really do our best to make it available to any client, no matter how large or how small your practice
Mhm.
might be. So it is a great thing that we do. And I appreciate that shout out, Sam. Um, this slide, dosing for our liquid NADs. So it is quite versatile. You could dose it IV, IM, or sub-Q, and God bless. Everybody wants to give their injection sub-Q. I mean, that is the only option, and thank you, semaglutide and tirzepatide for that, right? I mean, but nonetheless, it is great. I will say, aligning with liraglutide, the dosing regimen that we have for our NAD does call for more frequent injections. So I think it's anywhere between 5 to 7 times weekly you'd be injecting sub-Q, but that is just to ensure that NAD is staying within your system, pretty consistently. So our VP of technology, since I started, I've been with Olympia for now, I think just about 3 years. Our VP of technology still to this day, since I started to today, still is taking an AD daily. It's a phenomenal product, one that I've always wanted to try, but I'm already taking a once daily pill that I think my wife would almost just off me if I were to take another once daily injection of anything. But this is one that I would encourage a lot of folks to try. No doubt. It's supposed to give great mental clarity as well, I think, with the sub-Q regimen. And I think patients will be just extremely focused if that's what they're struggling with. I mean, I'm now 30. I wake up with brain fog all the time. From what I've heard, NAD will clear that right up, right? And you'll just be sharpened, focused. It is a great longevity product as well.
All right. Well, we've gotten to the end here. Again, if anyone has any questions, any follow-up questions, even specific to the items, absolutely feel free to drop them in the Q&A. If you haven't seen Olympia's product catalog or their formulary list that we have, you can use the QR code that's on the left here. It'll take you to IPC's landing page, where you can just submit that short contact form and they'll reach out to you to either get signed up or answer any questions that you have. And then on the right here, we do have information about our next webinar. Hayden, you did, speak to this a bit, but we're going to talk about, alternatives to, oral tablets for ED. These are definitely options that the majority of our pharmacies, have not jumped into, and it's going to be really beneficial. It'll be good to hear about this.
Yeah, absolutely. I will say, I mean, the key thing here is going to be Trimix, and I'll tell you, if you go to any urology office, they know what Trimix is, and it is definitely an easy sell. But the educational piece behind it is definitely key. So can't wait to talk more about that on the 28th.
Hayden, I do have a question for
Yeah.
you. Hopefully, I'm not putting you on the spot. When I talk to our members specifically about this space, we just had a large conference, McKesson Idea Share, that we were there talking to our members, and everyone is so curious and, really wants to make that leap in, offering these products to their patients. I feel there's some hesitancy on some pharmacies though, and perhaps that is, just knowing where the medication's coming from, right? Safety, protocols, dosing, what do you feel like sets Olympia apart? If you could just give us, a little bit of information there for anyone that's hesitant.
Yeah, absolutely. So I would say just from a broad overview, 503B to 503A facility, the amount of testing that goes into each of these products, I mean, ahead of time in R&D, right? I mean, we're always working on new formulas. I know a big product is BPC 157. That's an R&D now, but by the time we get to the end where we're actually ready to start dispensing product, it's about a 6 to 8 month I would say lead time from like the idea phase to when we are actually dispensing. From there, every batch that we produce, that has to go through rigorous testing with a third party. That takes upwards of 2 weeks to get back before a product even leaves our facility. I would
Okay.
say that's step one. I would say number two is going to be our responsiveness, no doubt. Our responsiveness, customer service, the clinical team that we have. There aren't a whole lot of 503Bs that are able to staff an entire team of clinical pharmacists, paying them a pharmacist salary, answering the phone and answering questions on, dosing. If there's a patient right there in front of you, I mean, you can definitely.
Uh-oh, we
Uh,
lost him.
There
There
we
he
go.
is.
you lost
You
me?
froze first. You froze for just a minute.
Holy mackerel. My Wi-Fi says I have everything. Where did you stop
You
me?
were talking about your clinical staff and
Oh,
how
yeah.
if a patient's in front of you, you could give them a call.
Yeah, you can give them a call, get an answer real quick. I mean, at the end of the day, there aren't a whole lot of pharmacies that have the ability to staff a team of 6 pharmacists at the end of the day. I think that is a huge separator. Over since I've been here, we've made a huge investment into our quality team as well as our engineering team. So we're able to address, the smallest of quality issues that might come up, right? I think quality and engineering make up more than half of our staff of 300 right now, across 3 different facilities. So I think we're putting all the eggs in the right baskets. Other things that I think,
I would agree.
am I breaking up again?
No, you're okay.
Okay. I think other things that pharmacies should look at before taking that leap of faith, 483s, they're out there, they're public. These are, recorded FDA audits that have gone on at each facility. There's no such thing as not having a 483, and it's looked down upon if you have a 483, but the FDA is there to find things, right? I would dig into what those items are on the 483, address those items on the 483, see, get some sort of clarity on why this happened and has there been a fix, so on and so forth. I mean, we send items to our quality team all the time to make statements on
Mhm.
that really come from clients. So those are a couple items I would say definitely dig into, but something that we're not afraid to address either.
Well, thank you for your transparency. We did look into those.
Yeah.
We feel very confident with our partner. We did have a question come in. Can you elaborate on the difference between the memberships? I think is the question. And if what you're referring to with IPC, we are this offer is open to our GPO members who are a part of our group purchasing organization. It's also open to our warehouse members. So if you're ordering from our warehouse, and you're not a part of our GPO specifically, this offer is open to you as well. We've got about 25 to 30% off all of their 503B products. Like Shannon said, we do have a catalog of products. And pricing, and Hayden's team is great about reaching out as soon as you fill out that contact form if you have any additional questions. But when I was talking about membership before, that's what I mean. You don't have to pay anything up front as far as, a membership to a platform or anything like that. It's really going to be the cost of the drugs for you. So open to our GPO and affiliate members that are using our warehouse. Let's see if there's any other questions. How do we know if we're a GPO member or a warehouse member with IPCRX? So we can look that up for you, but that will be on your account. But if you're ordering from us at all, we're a secondary wholesaler. But if you're ordering from us at all, then you have an account with IPC. So I can. My email is samantha.pomeroy, Pomeroy, at ipcrx.com. You can absolutely reach out to me. You can scan one of these QR codes, put your name in there, and we can look up your IPC account number. That's not a problem. Let's see, any more questions? I think that is it. Okay, did anybody have anything else before we end? All right. Well, thank you everybody for joining us today. Please reach out again with any questions. We hope that you feel, confident going into this space. Please join us for our next webinar on, the ED products and education around those. Education in this space is so important, and that's what we want to make sure that we're getting across to our members that are participating. So thank you so much.
Absolutely. Thank you guys for having us.
Thank you.